Hello and welcome to Talk of the Town. I'm your host, Kathy Healey. On today's show, we're going to be talking about the opioid crisis in the Middlesex County. More than 2.5 million Americans are currently addicted to powerful opioids. Drug deaths have shot up since 2010, rising 28% in just the past year alone. 175 Americans lose their lives every day to opioids. With me here today, I have three people who have a strong connection to this opioid epidemic. They are person in recovery, Matthew Albrecht, the Middlesex County Sheriff, Peter Koutoujian, and the Director of the Prevention of Unified Coalition, Dhingra. So we're going to start with the Sheriff. Thank you for coming.
My pleasure.
So tell us a little bit about your background. Where you grew up, where you went to high school and college?
Well, I'm a kid from Waltham. I graduated Waltham High School. I went on to Bridgewater State College, now university. I later attended New England School of Law. I got my law degree, and I got a master's in public administration from the Harvard Kennedy School of Government as well. I was a state representative for 14 years, a prosecutor before that for 4 years. And then in 2011, Deval Patrick appointed me as the Sheriff of Middlesex County. And then I've run for the position twice since that point as well.
That's terrific. And explain your role as Sheriff.
Well, Sheriff in Massachusetts is a little bit different from some of the rest of the country. We don't have primary patrol function, so we will lend support to Wakefield should they have need. We have a number of assets that we can bring to situations, K-9 officers and SWAT teams and things like that. But we let the local police do their job, and then if needed, we will support them. Otherwise, predominantly, we are responsible for the care, custody, and control of just about 1,000 men and about 100 women that go to Framingham that are either pretrial or sentenced to the House of Corrections in Billerica and the jail in Billerica.
Okay. So you're in charge of the prisons? Okay.
Well, for Middlesex County, yes.
Middlesex County. Oh, great.
Yeah.
Okay. And is this something that you've always wanted to do, or?
Never.
What
never. I never. It's funny you should ask that, because I always tell people your life can be sort of a wending journey that you don't know where you might end up. And I never expected in a million years to end up as sheriff. When my predecessor, Sheriff DePaula, was initially not going to take his next term, he was going to leave office before. And people had reached out to me and had suggested, based upon my background as being a prosecutor, my public health background, my political, I had some, I had accomplished, I had become an accomplished politician, I guess you'd say. I had built up my reputation, and that they asked me if I would be interested in seeking the appointment by the governor. And my first reaction was, no, not at all. But I've also learned never to say never. I started looking into the opportunity, and I just said, this is something I'd really like to do, because my predecessor was a very different model than I. But when I saw what you could do as sheriff, where you've got men that are in the throes of terrible parts of their lives, have mental health issues and substance use issues, and they've suffered from failures in education and poverty and trauma in their homes. And when I've been in public service my entire professional career, and when I then saw that I could do this for the least of us, right? The people that society really has not cared about, doesn't think about, rather lock them up, throw away the key, let them suffer. And I get the opportunity to help them turn their lives around, which to me is an amazing opportunity to show how much you care about your community, because you can, they're all humans, they're all people, they're all family members, they're our neighbors, they're our community members, they're our brothers and sisters and sons and daughters. I get to take these broken people and help repair them so they can go back to their families a little bit better and stronger than when they came in. That's something that's why I love this job.
Well, that's terrific. What would you be doing if you weren't sheriff? What would you think?
I really don't know, actually. I don't know. I've had an incredible public service career. I mean, I've loved every job I've had.
That's great.
But I didn't plan it out. I became a state representative. I didn't intend to run for office. I was able to chair the Committee on Health Care, Committee on Public Health, Committee on Financial Services. I was able to do a lot of great things during that time. I was a prosecutor for 4 years. I didn't intend to be sheriff. I don't know what the next stage of my career might be. I just know that right now I love what I'm doing, and I'm in a really good place. We've got a great office that's innovating. We're driving. We're doing some best practices. We're doing data-driven solutions where we've got probably about a half a dozen nation-leading innovative programs and initiatives that no one else is doing around the rest of the country, that we are being replicated, that these initiatives are being replicated across the country. We're being flown around the country to speak about them. People are coming into our shop to take a look. It's so inspiring and validating, and we're really doing great things, and we're enjoying what we're doing right now, and it's a special place to be for me and for my family right now and at this point in our lives as well.
That's great. That's terrific.
Yeah.
So let's shift gears a little bit and talk about the current opioid epidemic in the Middlesex County. What are your thoughts on the crisis, the causes, any remedies that you can speak
Well,
of?
let me say this. When I was the chairman of the Committee on Healthcare, I created an Oxycontin, a Prescription Drug Abuse Commission. That was in 2005. And we had a commission that studied this and actually published a report. It was a really good report. There was a number of great members of the commission. We did hearings across the state. We came back, wrote this report. That report is valid today as it was back then. Many of the initiatives are not done today as they weren't back then. And sadly, we knew then what we know now, and yet back in 2005 we had 545 deaths as a result of fatal overdoses. In this last year we had over 2,000 deaths as a result of fatal overdoses. And by the way, if it wasn't for the advent of naloxone or Narcan, those numbers would be significantly higher right now. So we have been losing this ground on this issue, and now it's much worse. It's exacerbated significantly because of the usage and the advent and usage of fentanyl as part of this product, and not just lacing but now replacing this product. That's what's really driving about 60 to 70% of the fatal overdoses. It's not just the heroin itself, it's the added fentanyl to that drug and other drugs that the people are using.
Do you believe in gateway drugs?
I do. Listen, I think everything's a gateway. You know, I mean, you've got to, you can actually, if you go back to so many of the men in my custody, their stories are almost identical. Many of them started smoking cigarettes, you know, and we, you know, I don't want to overvalue the idea of cigarettes as a gateway, but some of them started smoking when they were younger. They started drinking when they were younger. They started smoking marijuana when they were younger. And their stories of these incarcerated men are almost identical. They started doing this. They were a member of a team. They were doing well academically. And I'll bet you we have a lot of people from Wakefield, as we do from any city or town around here. They were doing really well, and then they started drinking, you know, occasionally on the weekends, then on the weeknights, and eventually they quit the team and they quit school, and they got a job that, you know, they didn't go to college, and then cycled through to the point where they had become incarcerated. I call these the men and women in the custody of corrections as the canaries in the coal mine, because I believe that the things that ail society, that make society sick, whether it's mental health issues or substance use disorders or failures in education or traumas in their lives or their social network, those things that ail generally society manifest themselves in much more significant ways and intense ways with a certain population that ends up a great deal of them incarcerated. And if we can actually fix what's wrong with society, then we can actually keep people more out of jail as well.
Right. Do you support the legalization of marijuana?
No, I oppose that. For one thing, we initially passed the use of medicinal or medical marijuana, and we were supposed to use that in an effort to understand what we should be doing about the potential for recreational marijuana. And before we even fully implemented the medical marijuana initiatives, suddenly the ballot initiative passed the use of recreational marijuana. If you take a look at the studies, every person, or you know, the percentages are very high of those that are incarcerated, those that become addicted to an addictive drug, that they started with marijuana. And by the way, marijuana dependence and addiction is a significant issue out there as well, that people don't think it's not that big a deal. There's a tremendous amount of addiction and dependence on marijuana alone, especially among the younger population, that people don't really understand or value or appreciate just how it's impacting that population as they age to step into further progression of drugs and alcohol.
Right. Great. I'm going to open the discussion up to Catherine Dhingra. So Catherine, if you'd like to tell us your background and where you went to college and where you grew up.
Sure. I grew up outside of Portland, Maine, in a little suburban town, and I went out to Ohio to college. And then after college, I came back to Maine, and I just found a job working for, actually it was a tobacco settlement grant. And so I started doing tobacco prevention work up in Maine, and I moved down to Boston and really became passionate. I had no idea what I was going to go into. I was a history and women's studies major, and I just saw the impact of prevention and kind of what you were talking about, really kind of looking at the data, looking how you could make an impact, and doing that type of work. So I came down, started working in Malden, and worked in Lynn, and I got a master's in nonprofit management. And I came to Wakefield because I was running a drug-free communities coalition in the city of Lynn, and I was helping the one in Wakefield because I live in Wakefield, get up and going. And then when we got the grant, the health director said, would you consider coming over here and running the Wakefield Coalition? So that's how I ended up in the position I'm at now.
That's great. So
I've been working in the field about 20 years.
Oh, wow. So tell us a little bit about what your job is as director of the Unified Prevention Coalition.
Sure. So Wakefield Unified Prevention Coalition is really one of the model substance abuse prevention coalitions. We have parents involved, youth involved, school faculty, community members, police, mental health professionals. We all come together and we really look at what's going on here in Wakefield, looking at our local data, looking at everything from mental health statistics, suicidal ideation, to opioid overdose deaths. And we really look at it and say, you know, what are some things that are unique here, and what are some things that we can address to really look upstream? You know, what's going on with a youth? Why would they start smoking cigarettes at 12 or 13, and what's that going to lead to? So really trying to wrap around services for young people, and give parents the power to really, you know, talk to their youth, and really kind of provide them with the resources they need, provide teachers with the resources they need, like mental health first aid. So really strengthen our community and make sure everyone's talking, making sure the police, if they have an initiative that they think would work, let's bring the schools together, let's bring our mental health providers together, so we're all talking and addressing things in the most effective way possible, and then communicating it out to the community.
Can you give us some stats on the town of Wakefield?
So, well, we're just talking about marijuana, and we are seeing the impacts of legalization. We saw about 18% of youth in high school reporting use in the past 30 days last year. Well, that jumped up to almost 30% a year later. So we had back-to-back data, and we could compare it with the rest of our Middlesex League schools. So that's something that we're really concerned about. So we see that jump, and it's, you know, it's hard because it's kind of out of our control locally, but youth are getting the message. It's healthy, it's medicine, it's okay. So that's something we're really concerned about, because what is that going to look like down the road? And we know from local statistics that in our recovery high schools, the number of the youth that are there are for marijuana use. So we're really looking at that. And then, you know, the prescription drug use, it's hard because a lot of it doesn't start in high school. Some does, some Adderall sharing and some norming of the prescription drug use happens then. But a lot of times it's after high school and in college. So we don't have the wraparound services available then. So that's why that primary prevention is important. And that's why working with the police department, the sheriff's department, really working across our community to provide resources. But unfortunately, our opioid deaths are going up because of the fentanyl.
In the town of Wakefield.
In the town of Wakefield, across Middlesex County. We're pretty much trending with the rest of the county. And the same thing, 70% of our deaths here in Wakefield were fentanyl related in the last year, and some polysubstance use as well. The other thing that we're looking at too is like who are these individuals, and we've recognized that about 60% of those individuals work in the trades. So that's something that we're working with our building department and doing outreach with the unions, and things like that. So really kind of working with our VOC, our vocational school here is a fabulous resource, and they are really working with us to collect data there, just understand, are there specific trades that are more of a concern than others, higher injury rates and things like that. So that's...
It's important to note too that there has been a slight downward bend in the number of opioid overdose deaths in Middlesex County by about 10%.
Correct. Yes.
So it's coming down a bit. Now let's hope that that's a trend that we can continue. I think it is the result of the work that you're doing, Catherine, and people are doing throughout the county, especially the district attorney's office, the police, and us in corrections. And then all the nonprofit groups, and probably a greater awareness and less stigmatization that are actually helping drive that down. Now the number of, sadly the number of overdoses are up, but the number of fatal overdoses are down, which is not a good indicator as well. That just means that we're stopping people from dying more quickly, but at least we're stopping people from dying.
So Narcan you guys definitely believe in, and I think people are building up tolerances now, I've heard, with the Narcan. So it's costing more and more for some police departments.
Well, it's the potency of the fentanyl,
Yes,
which
the fentanyl.
will cause. So it used to be 1 or 2 doses of Narcan to reverse an overdose, and now sometimes it's 4 or 5.
Right. So it's really the fentanyl. So it's not just. I don't know about the tolerance. That might be an issue. I've never heard that before. But it's the fact that it is fentanyl. So you need a lot more of the Narcan administrations in order to stop to arrest the overdose.
And Gloucester Police Department has a program called the Angel Program, I guess. So if an addict comes in, they'll hook them up with a police officer and take them right to the hospital. And I believe Wakefield Police Department will do that as well.
Yeah, our police department is wonderful. They have the CIT program, so all of our officers have a lot of mental health training, really compassionate. And then we have a family service officer who works with a part-time social worker who goes to every home where there's been an overdose and helps provide wraparound services. So that's in conjunction with our health department. So we're hoping to bring in a recovery coach too. So that's some things that we're doing. But it's great because in Massachusetts, it's a great collaborative environment. We can learn from other communities what's working well and then adapt it to what works well with us. And then, and then the sheriff's department's talking on the national level, so we're able to say, okay, what are they doing in San Antonio? What can we do here? And things like that. So that's one positive thing in a really difficult climate to work in, that people are collaborative and willing to share best practices.
Well, that's terrific. It sounds like a great program. So now I'd like to open it up to Matthew Albrecht, person in recovery. So Matthew, can you tell us where did you grow up?
I grew up and I graduated from Norwell High School, class of 1999.
And can you tell us a little bit about your high school experience?
I was a little bit of an outcast, but I was involved in sports, mainly hockey.
Okay. And did you start using in high school, or was it after high school?
It was before high school, in junior high.
Okay.
Started drinking.
Okay. And then you
alcohol, cigarettes,
and then you smoked marijuana back in that time too? Okay. Did you ever use any strong opioids or anything in high school?
Yes, but I kind of went up the ladder. I went from alcohol, pot, tobacco, then hallucinogens, then ecstasy when I was able to get into nightclubs.
Okay. And what did you do after high school?
I joined the IBEW, the electrical union.
Yeah.
Out of Brockton.
Oh, that's terrific.
Yeah.
You worked as an electrician.
Yes.
Were you still using?
I was.
Okay.
And then in my mid-20s, I ended up taking over my father's pest control business.
Okay.
So I was doing that, and I dropped out of the union.
Okay. And what brought you into the unfortunate circumstance of being
it was actually a fear of jail. I got some pretty heavy charges, so I took it upon myself to self-inflict a gunshot wound to the head.
You were using drugs and you got incarcerated?
No.
Not incarcerated, just indicted. Okay.
Yeah.
So were you seeking any therapy before that, or?
No, I was not.
Okay.
I had bouts of sobriety here and there.
Okay. And where are you now? What?
I live in a group home for acquired brain injury or traumatic brain injury individuals in Salisbury.
So that's great, and you like it there, and a good
It's
place.
better than where I came from. I was, before there, I was at Tewksbury State Hospital.
What message did you want to give people out there that maybe kids that are using or people, that adults that are using, that are watching, what message do you want to give them?
Seek help. Deal with your problems instead of trying to take the easy way out. Go into substances. It's okay to talk about your feelings or whatnot. I mean, I was raised by a Marine, so.
Okay. And you feel like if you had gotten some help, it wouldn't have gotten this bad?
Yes.
The drug use.
And another thing with quitting is you have to want to quit.
Right.
You have to hit the bottom.
You have to hit rock bottom.
Yeah.
Right. Right. And I'm sure you see that a lot, Sheriff, when you, with your people that you see, that you have to hit rock bottom.
Yeah, I mean, and being incarcerated is not necessarily rock bottom. Right? It can get much worse than that. We sort of take the opportunity. Listen, let's talk about the issue of substance use in our jail. 42% of our newly incarcerated individuals, both in pretrial and sentenced, have to be medically detoxed for drugs or alcohol, predominantly for opioids. So that's over 2,000 men we had to medically detox using medical best practices to clean out their systems. It's a pretty sick population.
And you do that right inside the...
Right inside, yes. We have the medical facilities. If it's something more complex, we'll always refer them to outside hospital, but we can handle that in our medical unit. Our medical unit is really robust. We have about 180,000 attendances through our medical unit in a jail of about 1,000. You consider that Lowell General Hospital emergency room sees 100,000 people in a year. We are really robust. We have excellent personnel, and quite honestly, for some people, an incarceration can be a very bad thing.
Okay.
It can take you out of your life. It can increase your rates of recidivism and exacerbate your mental health issues and substance use issues. But for many, it can actually be that opportunity, that window of opportunity to help them stabilize themselves, get their act together, use some program we provide, and whether it's our Matador program for opioids as they are released into the community, which is a nation-leading program, the opportunity to turn their lives around. But I'll say this, I'm really proud of the programs we have. We've got a number of great programs in there, but you shouldn't have to come to jail to get good programs. You should be able to get it on the outside so you never have to come to jail in the first place. And that's my frustration, is that society is so quick to allow the largest mental health treatment facilities in the country to be jails. I mean, we're the largest one in Middlesex County. The 3 largest mental health treatment facilities in the country are LA, Rikers, and Cook County jails. That's a sad statement of society when your jails are the primary mental health treatment facilities. And yet society has sort of acknowledged that's true and said, well, that's all that we can do. And we're not trying to take care of these people out in the community before they come to us, so they don't have to come to us. And then we don't take care of them once we release them. So we can do all the programming and we can have this great set of programs and educational opportunities. And people come out and they know what they need to do, but the supports aren't, and society has not given them the proper supports when they get out to help them stay out as well. So it is a very frustrating thing to be in corrections, because you know that society could do a better job itself. And while you're trying to do everything you can and you're doing some really amazing things, society isn't holding up its end of the bargain. And I don't mean society, just people. I just mean the government, the structures, the medical community, the addiction community, not doing what they need to do in order to stop these people from becoming incarcerated and further disrupting their lives.
Do you have anything you want to add?
Well, yeah, so along those lines, one of the things we did in Wakefield was we said that's exactly what it is. People aren't getting the help they need beforehand, so we brought in a program called Interface, where we can connect people to mental health resources. So for the cost of $12,000 a year, we split the town, covers half, the schools cover half. And any resident birth to death in Wakefield can call this line and say, this is my insurance, this is what my issue is, whether it's mental health, whether it's substance use, and the agency will do all the work to link them to a provider who is close by, who has an opening when they need it, who matches their insurance. So That program's working. We've had it about 3 years. We get about 65 matches every 6 months. So we're seeing people connected to the resources that they need. It's really overwhelming. I'm an educated parent, and I had to find those services for my child, and it was really hard. I hit a lot of roadblocks, and if I had that service to get me through it, it would have been a lot easier. And this way, we're just trying to break down those barriers so people can access care earlier. And then on the other end, when people are in treatment and coming home or in intensive outpatient treatment, really finding ways to kind of create that new network for them, because you can't go back to hanging out with your friends that you were hanging out with before. So you really have to create a new network for yourselves, and really figuring out ways and systems to make that happen. And that takes kind of high-level policy and funding to make that happen.
It's a social network that brings you in, right?
Yeah.
Matthew could probably remember this. You're hanging around with the wrong crowd.
That's right.
Your friends are getting arrested, and you maybe didn't do a stint of incarceration, but you're hanging around with the wrong crowd. You're having fun. By the way, when you are incarcerated, I've asked dozens of young men, how many these are your best friends on the outside. You hung around, you had your laughs, you horsed around. How many times they come and visit you? Literally dozens of men, not a single, not even one time. So when they go back out, who are they going to hang around with? This is their crowd. This is their family. This is their network. It's really hard to go back out and not be with that network, even if you intend not to participate in the more illicit activities. Eventually you can't help it, because that's just who your whole network is out there.
That's correct.
Yeah, and so that's why when we speak about these programs, we use a program we call Matador, medication-assisted treatment of directed opioid recovery. It's using an injectable naltrexone called Vivitrol. So you have your methadones and your suboxones, which are called agonists, which are, for all intents and purposes, lower dosages of the opioids to be able to keep you on a prescription level and not have to go to the illegal drugs. The naltrexone, or the injectable Vivitrol, is a month-long injectable that will actually block the highs and reduce the cravings. It's a pretty miraculous drug, but no drug alone will work. You have to have the treatment component. What we do is we prepare them inside, we educate them inside, we give them all the programming inside, and then as they're about to leave, we'll give them that first injection of a shot. We'll set up all their appointments with the community health providers. But the real secret sauce to what our program is that has shown incredible success is we have assigned navigators to them that will then stay in touch with them for that first 6 months. We also can collect all the data from that. And so they stay in touch with them. So the social network turns on its head. So now you've got someone that really cares about you, and for many times their first call when they're having a child, or they're getting their high school equivalency or graduating from high school, is to our navigator. And so our data is showing really good results as a result of recidivism numbers, and as harm reduction, the number of fatal overdoses off of all of those in our program, both that have been successful, have completed the program, or have not completed the program, are remarkably low too. So that's part of the initiatives, along with Wakefield and others. It's actually driving down the curve. We've got a lot of work to go. The sad part is this program has shown incredible success, and yet it's still not being replicated. Actually, Franklin County, Ohio, where they've now eclipsed us as overdose death capital of the United States, Massachusetts. They've actually replicating. I spoke with the Florida sheriffs, the Maine sheriffs recently. So they are talking about it. But that navigator piece, you can't just give someone medication and then that's the treatment. There's a treatment on top of the medication. People forget that. Why we were in there in the first place, gave them a drug, everything's going to be fine, no pain. You kind of forget drugs are not the answer to everything unless you have the supporting systems around them to make sure that they don't become the problem.
Because usually it's that underlying mental health condition. It's going to be there, so they need that support along the way.
Right. The co-occurrence rate on people, they call it co-occurrence rate, those people with a mental health issue are much more highly likely. Sometimes in our shop it's about 78%. It can be generally around there. Also likely, so if you have a mental health issue, 78% or more are then also likely to be addicted to. So this is something, how do you extricate them? You're dealing with a mental health issue and a substance use disorder at the same time. It's a very complex matter, and how you pull people away from those elements that drive them into despair and into trouble.
Right. Wow, well, thank you. Matthew, anything you want to add before we end the show?
No, not really. I mean, all I can say is what it took me to quit was shooting myself. That's how bad I was. That's how strong the addiction to opiates is.
Yep. Well, we're glad you're here today.
Thank you.
And I want to thank you all for coming on the show today. Really appreciate your time and information. Thank you for watching Talk of the Town.